Good morning, and thank you for joining this breakout session. My name is Vanessa DeZono, and I'm the Clinical Trial Study Manager at the Vancouver Stroke Program.
And I'm Ishmaeli de Souza, a research assistant in the Vancouver Stroke Program and also a PhD student in the School of Nursing at UBC.
We are presenting the results of our work focused on knowledge translation initiatives about brain and heart health in adult congenital heart disease, in particular, what we have learned from patients.
As we begin this presentation, we would like to acknowledge the lands in which we work and the Indigenous peoples who have been living in these lands for centuries. The Vancouver Stroke Program is located at Vancouver General Hospital, and so we acknowledge that we work in the unceded, ancestral, and occupied territory of the Musqueam, Squamish, and Tsleil-Waututh nations.
As a result of medical and surgical advancements over the past several decades, people with congenital heart disease are living longer, the majority of whom are now adults. Some individuals with congenital heart disease will have brain or abnormalities from birth that may accumulate into childhood. Adults with congenital heart disease remain at risk for stroke and abnormal vascular risk factors, which is known to be related to cognitive decline and dementia in other groups. Despite this, adults with congenital heart disease don't typically see a neurologist as part of their routine follow-up. Therefore, patient and caregiver knowledge about the brain-heart connection is unknown.
The purpose of this study was then to identify gaps in knowledge associated with brain and heart health through facilitated discussions with people with lived or living experience of congenital heart disease and their caregivers. Our study was guided by two main frameworks. We used the principles of integrated knowledge translation, which is an umbrella term used in approaches to research projects centered on active collaboration between researchers and knowledge partners. And by knowledge partners, we are referring to researchers from different disciplines, policymakers, clinicians, organizations, people with lived or living experience, caregivers, and so forth. And we're also guided by the principles of interpretive description, which is a qualitative methodological approach for developing knowledge that can inform healthcare practice and policy. In line with our integrated knowledge translation approach, an advisory committee was established for this patient engagement initiative and included stroke neurologists, a cardiologist, a rural family physician, a clinical nurse educator, research personnel, and people with lived or living experience of congenital heart disease. In order to achieve the purpose of this study and identify gaps in knowledge associated with brain and heart health, we used a breakout session in the context of a virtual patient and family forum as data sources. The breakout room session acted as a focus group interview. In addition, we sought the services of a graphic recorder who translated the presentations and discussions during the virtual forum into text and pictures.
We recruited people between the ages of 18 and 49 with the diagnosis of moderate to great complexity congenital heart disease. Caregivers or family members of people with lived or living experience of adult congenital heart disease were also invited to participate in the forum. Participants needed to be fluent in English. Invitations to the forum were shared through a private Facebook group and emailed using the Pacific Adult Congenital Heart Disease, or PATCH, Clinic's permission to contact database. The forum took place on the morning of Sunday, September 26, 2021, via Zoom due to restricted in-person activities. 7 participants attended, including 1 family member. The agenda was developed by the advisory committee, who held different responsibilities during the event and included stories from our patient partners, educational sessions about the brain-heart connection, a breakout room discussion made of 2 focus groups, and an FAQ session. Attendees were assigned to 1 of 2 focus groups. A semi-structured interview guide was co-created by our advisory committee members. 2 advisory committee members with lived experience of congenital heart disease led the focus groups, supported by a clinician. Focus groups lasted approximately 60 minutes, and research assistants took notes in addition to audio recording for automatic transcription.
One researcher was responsible for analyzing the transcripts from the two focus groups. This included an iterative back and forth process of immersion with the data, deconstructing it using broad-based inductive coding and constant comparison methods to identify patterns, similarities, and difference within and across the two focus groups. After transcript analysis, the researcher read the observer's notes and analyzed the graphic recorder output. No new codes emerged from this later process in comparison with the focus group's transcript analysis. During the process of reflecting on the data and attempting to move from description to an interpretive analysis that was meaningful for clinical practice, we pivoted the research question. It became clear that the research question we sought to answer about the knowledge gaps in the brain and heart connection among people with adult congenital heart disease could not be derived from this study due to a lack of awareness from participants that such connection exists. Therefore, the new research question was aimed at exploring what we could learn from people with adult congenital heart disease that could inform knowledge translation initiatives about brain and heart health. After revising the research question, teams were developed and a narrative account that could be meaningful for practice was constructed. The advisory committee discussed the themes and narrative account during a group meeting, and as a result, an additional meeting to seek the views of the clinical team at the patch clinic was decided to gather meaningful input. In these next slides, we present the preliminary results of our work pending this future meeting. Despite demonstrating excellent knowledge about their overall condition, including their specific heart effect and diagnosis, participants described a lack of knowledge about brain health, an area that most identified as not explored during any healthcare encounter. For some participants, the virtual forum was the first time they were made aware of the connection between brain and heart health. Brain and heart, and a motivating factor for attending the event. Therefore, participants were enabled to answer the what of these knowledge translation initiatives, what should be included, what gaps existed in knowledge of brain and heart health. People with congenital heart disease have dealt with so much throughout their lives, and therefore the idea that they may need to face future adversities was difficult to overcome. We then focused on constructing a narrative that could answer who should be involved in knowledge translation initiatives, where knowledge translation initiatives should occur, and how. Our findings revealed that knowledge translation initiatives about brain and heart health should focus on the individual with adult congenital heart disease and involving family members and peers, use social media and healthcare encounters for knowledge dissemination, and be a balancing act between avoiding feelings of worry about the future's uncertainty and also empowering people with adult congenital heart disease. Participants usually sought knowledge about congenital heart disease from peers and family members. However, they relied significantly on their efforts. As one participant depicted, and I quote, "You have to seek it out if you're interested, or if you're not interested, you just kind of, bury your hand in the sand and just pretend like everything's good." The overall lack of resources for people with congenital heart disease was one of the factors behind their belief that they had to rely on themselves. And in addition, the existence of various congenital heart effects and not a one-size-fits-all knowledge approach to congenital heart disease made participants feel they were alone, especially as a child. During childhood, parents were the only support system for our participants. However, that was no longer the case during adulthood, and other family members, such as partners, have occupied that position, as the quote from participant D exemplifies. Peers with congenital heart disease also played a significant role in the lives of our participants. Those who had found a community of people with congenital heart disease welcomed the ability to share resources, talk about shared experiences or other ways of socializing. As one participant noted, and I quote, "We have the Pacific Adult Congenital Heart Disease group where some people ask for advice or you can talk to other people. Through the Patch Clinic, there is actually a group of us that I have met up a couple of times just for coffee. And so that's been really nice to talk about common experiences. An important facet of this peer-to-peer support was intergenerational learning. Participants highlighted the importance of learning from the experience of older people with congenital heart disease. The intergenerational peer-to-peer learning was also evident when one participant proposed developing a program to connect adults and children with congenital heart disease to support the parents of the child. Social media was also an important place where our participants learned about congenital heart disease and connected with peers. Participants spoke about existing local and international Facebook groups for people with congenital heart disease and other more specific gender-only groups. Healthcare encounters also represented an optimal way to disseminate new knowledge. Some participants felt that new knowledge should not be disseminated by a single healthcare professional, but shared among the healthcare team and disseminated by the practitioner they saw most frequently. The quote from one of our participants exemplified this, and a preference to receive new knowledge from their GP. However, others prefer to receive new knowledge about congenital heart disease from the healthcare professional specialized in the area and more likely able to direct them to further resources. And this is also noted in the quote from participant G. And lastly, knowledge initiatives about brain and heart health should be a balancing act, as our participants said. This dichotomy was characteristic of participants' approach to living with congenital heart disease. On the one hand, they reported an attitude of just living with it, uncertainty about wanting to know what to expect in the future, avoiding worrisome feelings, or even forgetting about having the condition itself. As one participant stated, and I quote, "To be honest, I kind of forget about it until I get the message, it's time for your checkup at the Patch Clinic," and things like that. And I just forget about it in my case. On the other hand, participants identified the need to empower people with congenital heart disease due to the lack of evidence-based knowledge on the connection between brain and heart. As one participant described, I think it's a fine line between being overwhelmed with the information and worried about the future, compared to being educated and empowered with, okay, I have the information, I have options. Things may or may not happen.
Here is a video of the graphic recording created during the forum, depicting some of the content discussed. It includes information on stroke, cognition, brain health, and lived experiences of those with congenital heart disease. This graphic has been shared with our attendees and used in recruitment materials. It will also be added to the study website. Findings from the study will be presented to a wider group of healthcare professionals involved in treating adults with congenital heart disease. We anticipate that this engagement will drive meaningful future knowledge translation initiatives to address the brain-heart connection, in hopes of empowering and improving care for those affected by congenital heart disease. This may include resources and tools for patients and caregivers, as well as their treating clinicians. We're so grateful for the hard work of our team and the support of our funders. This concludes the end of our presentation, and we're happy to take any questions at this time.